Hello, I'm a respiratory practitioner with a background in physiotherapy from Gloucestershire's Respiratory Service. In this education session, I'm going to discuss sputum clearance for patients with chronic lung conditions. I'm going to cover what sputum is and how it is normally cleared, how to manage the sputum day to day, and why clearing the sputum is important. I will also teach you an evidence-based method to clear the sputum. With regards to the lungs, sputum, phlegm and mucus are often interchanged, but used for the same thing. Sputum is a sticky mucoid fluid produced by the nose and larger airways in the lungs and the bronchi and the bronchioles. Sputum has two main functions: to protect the thin lining of the airways from irritants such as dust, pollen, foreign bodies by covering the airway lining in a film of mucus to help humidify the air we breathe in. This makes it easier for oxygen to pass into the blood. Sputum production is an essential process in the lungs and helps with breathing efficiency. The mucociliary escalator is a defence mechanism in the lungs which aims to remove foreign particles that have been trapped in the sputum. The lungs will try to move the particles along the airways. Within the lungs, there are different types of cells. One of the cells is called a goblet cell. Goblet cells produce a gel layer of sputum, which is sticky and contains immunocells to destroy the bacteria and viruses. This helps protect the underlying cells in the airways, as foreign bodies are trapped in the sticky layer. Also in the lungs are upright hair-like structures called cilia. These are surrounded by thin films called sole layer. The cilia move into rhythmic beating motion which pushes the sputum from the deeper airways to the central airways, then to the windpipe and up to the throat, where they are either swallowed or cleared. In some respiratory conditions, the mucociliary escalator can become ineffective or damaged. For example, with bronchiectasis and COPD, there can be damage to the airways, cell lining, and the cilia can be destroyed. Also in these conditions, particularly in bronchiectasis, the volume of sputum produced due to the disease can overload the mucociliary escalator. Additionally, in those who have a history of smoking, it is now understood that cigarette smoke can impair the function of the cilia, and with prolonged exposure destroy them. Sputum that is stuck within the airways can be the perfect breeding ground for bacteria, because the lungs are warm and humid, and bacteria thrives in this sort of environment. Sputum that is stuck in the lungs leads to an increased risk of infection. Recurrent and severe chest infections can cause further damage to the airways and makes it more difficult to clear the sputum. An important part of effective self-management for your condition is to keep your chest as clear as possible to protect you from infection. The following simple steps can be beneficial in managing the sputum day to day. Try to ensure you breathe through your nose at rest. Breathing through your nose at rest is important because your nose has hairs inside that warm, humidify and filter the air that you breathe in. Hydration is important in managing your sputum. Being dehydrated can lead to the sputum being thicker and stickier. Poor hydration in the airways can also affect the functioning of the mucociliary escalator. Water is the best source of hydration. Taking your inhalers and any other respiratory medication, as prescribed, can help maintain your airways. Bronchodilators, which are in most inhalers, help to keep your airways open, which can allow the sputum to move more freely. Some people may take a medication called carbocysteine, which is a mucolytic. This drug is used to reduce the stickiness of the sputum, making it easier to cough up. Being physically active and moderately breathless during activity causes you to take larger breaths, which can help move the sputum along your airways. Knowing what your sputum is like on a normal or a good day is very important in the management. Changes to the sputum colour, its amount, texture, or the stickiness can be a warning sign of infection and can aid early management of flare-ups. The active cycle of breathing technique, or ACBT for short, is a very effective way to clear your chest. There is lots of evidence to support the use of this chest strategy with different lung conditions, Active cycle of breathing consists of 3 components: deep breaths, also known as thoracic expansion exercises, breathing control, and huffing. If it has been prescribed, it is recommended you take your bronchodilator medication approximately 10 minutes before commencing with ACBT. This is commonly a salbutamol inhaler or nebulizer. ACBT is usually performed while seated, ensuring you're sat in a well-supported chair with a neutral spine, with your head and shoulders relaxed. This can enhance the function of your diaphragm and pelvic floor. During the technique, try to minimise forceful coughing. Coughing is appropriate when the sputum is ready to be cleared, but forceful coughing, when your sputum is not ready to be cleared, can be counterproductive, and it may cause your airways to spasm and tighten. At the start of the cycle, take 4 slow, deep breaths in through the nose if possible. Hold your breath in for a count of 3, then breathe out normally. Do not force the air out. Following the deep breaths, move around to the right on that cycle. The next step is breathing control. Breathing control is a period of relaxed breathing at your own resting rate and is completed between more active parts of the cycle. Where possible, you should breathe in through your nose, as this helps to humidify, warm and filter the air and decrease the turbulence of the inspired flow. This should be completed with normal sized breaths, also known as tidal volume, but not large breaths. Ensure your neck and shoulders are relaxed. As you breathe in, your upper chest should remain relatively still and your abdomen should slightly rise. Continue with breathing control until your breathing has returned to its restful state and you have recovered from any shortness of breath or bronchospasm. As per step 1, repeat the 4 deep breaths, holding in for 3 seconds and exhale. Once you have completed your deep breaths, move around again to breathing control. The next step is step 5, which is where we move on to performing a huff. A huff is a manoeuvre used to move secretions from the airways towards the mouth. Usually we suggest completing 2 types of huffs. The small, long huff involves taking a small to medium breath in with a longer huff out, with your mouth open in an O shape. The big, small huff involves a large breath in, pause, and then a short, sharp huff out with an open O-shaped mouth. It might help when you perform the huff to imagine you're steaming up a mirror. A few key tips to try to remember are spending 10 minutes a day that can really help clear the sputum, which reduces the risk of infection. Uncontrolled, ineffective coughing is exhausting and can make you feel short of breath. Have a good go at the cycle in your own time while sitting and let us know how you get on. Huffing is more effective than coughing as it moves the sputum from the lower down parts of your airways. Try not to cough unless you think the sputum is ready to clear. After performing the huff, attempt to recover with breathing control. If you feel that there is still some sputum to clear, repeat the cycle. If after carrying out the cycle or the breathing technique, you continue to experience difficulties clearing the sputum, please speak to your respiratory practitioner. They will be able to suggest alternative methods you could try.